Good morning. Thank you for coming in today to the clinic. I just wanted to follow up how Max's IEP referral is going.
Hello, Dr. Vergas. I'm so glad that you asked. I heard back from Max's school, and it appears that they're going to do an assessment to see if he qualifies for an IEP. And I'm really happy that the process is moving forward. But I would like some more information about what happens during the assessment. Are there any specific tests that Max will have to prepare for? And is there any way that he can prepare for those tests?
That is great that Max is moving forward in the IEP process. And this is very important because everything from this point on, such as the services and assistance in school that Max will be hopefully receiving, is based on the assessment. Max will be tested in all areas of suspected disability. So for instance, since Max is not doing grade level and he's have trouble writing, they will perform tests that focuses on those areas. If you're concerned about other things like his impulse control, you can also request that the test be done to assess his behavior and emotional status. However, California law requires that students that have learning disabilities and who show serious behavioral problems be given a functional behavioral assessment.
Max is so young, though. I'm worried that Max may not even understand the tests, which could possibly affect his performance on them. What if he doesn't have a learning disability and he's diagnosed with one because he didn't even understand what he was supposed to do on the test?
Now, these tests are created that they are not racially, culturally, or sexually discriminatory. For my patients whose primary language is not English, I encourage parents to ensure that these test materials are given in the student's primary language. So Max does not need to prepare anything beforehand. And if there's some things that you can ensure that he receives the best services, is to know that you are the expert on Max. You are able to supply history and knowledge about Max to ensure that the services he needs. For instance, you can pass out past and current teachers' observations about Max's school performances and his behavior in class. Other reports could be like his reports from the regional centers and from doctors. For instance, if he's seen a speech specialist, or if the reports from his ophthalmologist. Even observations from counselors at Max's after-school program or summer camps are useful.
Well, I really want Max to get help in school. What sort of things are they looking for during the assessment?
There are about 14 categories that can qualify a student for an IEP, and they are autism spectrum disorder, deaf blindness, developmental delay, emotional disturbance, hearing impairment, intellectual disability, multiple disabilities, orthopedic impairment, other health-related impairments that results in limited alertness in academic school environment, specific learning disabilities, speech language impairments, and traumatic brain injury and visual impairment, blindness.
So in Max's case, they would be testing him to see if he has a learning disability that is affecting his school performance.
Exactly.
Well, what if I have a specific concern that is not being addressed by the school through their list of assessments? Am I able to request a specific assessment?
Absolutely. Once the school sends you a list of assessments that they are going to conduct, and if you feel that it is a suspected disabilities that they have not focused on, you can request for an assessment to be conducted in that area. So it's important to know that the school cannot perform any assessments that you don't agree to.
So far, everything sounds good, but I do have a concern. How will having a diagnosis of a learning disorder affect Max in the future?
I completely understand your concern, but if the IEP assessment shows that Max has a learning disorder, it will not be something that will negatively impact his future. In fact, having the services in place will help him progress academically, and so that it will not follow him throughout his schooling and further into the future. As Max progresses throughout his schooling and his performance hopefully improves with his services, it is possible that he will not need IEP in the future.
Oh my goodness, I'm so relieved to hear that. I also have another concern for you, though. You're Max's doctor. However, the school is performing the assessment to see if he qualifies for the IEP. I'm worried that he may have ADHD. Who can actually make that assessment?
The school can conduct evaluations to diagnose ADHD as long as the evaluation is administered by a trained professional who has been trained so that they meet the requirements of the state and federal laws. However, the school can also decide if the physician is needed to make the diagnosis, and if so, it would occur at no cost.
Thank you for all the information that you gave me today. I'll keep you updated about how the assessment goes.
Great! And if there's one thing I want you to remember today, is that you are the expert on maths.